we go, 0.61 to 0.86. So somewhat higher, showing that there is, of course, room for an individual component along with behavioral parent training. Shadis in 1993 did a meta-analysis looking at adolescent parent training. I'll be talking about both parent training with both children and adolescents. And they were looking actually at conduct disorder and aggression only during that meta-analysis. And there were 11 RCTs for parent training with adolescents, adequate sample size. They found an effect size for parent training only of 0.41 with adolescents. So again, almost half a standard deviation in change. And 11 randomized controlled trials for parent training plus some level of individual or systemic intervention. And found an effect size about double, 0.83, which recommends even more for parent training with adolescents, that an individual component is highly recommended rather than parent training by itself. However, as we'll talk about briefly later, when adolescents refuse treatment and are not participating, parent training by itself can also be an effective intervention. All right, so moving on to talk about some theoretical underpinnings. First, a lot of this was based on what was called the coercion cycle, and that term was coined by Patterson and Reed at the Oregon Sciences Learning Center. So what they observed oftentimes in waiting room behavior was that the parent would make a request, or the child would want something, and that goal would be blocked, to play with the toy, to stand up and leave, or something else, which then led to the child escalating when the parent said no or make the request, throwing a tantrum, saying no, yelling or screaming, which generally resulted in the parent escalating the intensity of the request or the no, which would then continue on with the child escalating and the parent escalating and the child escalating and the parent escalating, which would eventually lead to the parent giving in and placating the child as the behavior became too loud, obvious, or embarrassing. And this would result in the child being positively reinforced for noncompliance and escalated behavior, and the parent being negatively reinforced to cede to the child's demands by the de-escalation in their behavior. So what is behavioral parent training? First question would be, how does behavioral parent training differ from more general family therapy? I think in several ways. The first is that in order to really be behavioral parent training, there has to be an ordered presentation of the skills to the parent. Each of the skills actually tends to build on the next, and so having that ordered presentation is important. And the skills are presented and explained, especially in terms of explaining the skills. Forehand is found in some consumer satisfaction surveys that the more theoretical background and explanation is given to parents about the reasons for each skill being there and why they are the way they are, the happier parents tend to be and the more willing they are to use the skills. Then the skills are modeled by the therapist and then coached, usually in a role play, although depending on the age of the child, it can oftentimes be staged first in a role play, second directly with the child with younger children, and then lastly generalized to home. So some assumptions of behavioral parent training. The first is presented to parents, and today this is going to be less than a how-to and more what are all the elements that go into it. But the first is a positive reinforcement role. The idea that when a behavior occurs and something happens at the time or soon after the behavior that's reinforcing, the behavior will tend to increase in intensity, frequency, or duration. So as it reinforces, it increases. The second is the attention role. This is the idea that the primary external reinforcer for everybody, children and adults alike, is in fact attention. The phrase is that we all have this tendency, this sort of internal drive, with a very small exception percentage of autistic or schizophrenic individuals, to feel connected with other people. And the way we're social beings, and the way that we feel connected to others is through attention. You can be in a crowded room and feel completely alone. Sometimes use the example that Manhattan's called the loneliest city on earth, but there's, I think, 14 million people on a tiny little island. And this, again, comes back to the way in which we feel connected to others. That basic coin is by having their attention and them having ours. And that's why it's so reinforcing. Though there's a longer format explanation, just the short is that all attention is equally reinforcing, both positive and negative, in different ways. Which leads to two situations that we want to work on avoiding. The first being the criticism trap. And this is the most natural thing in the world where we, parents spend, and all of us, when we see a problematic behavior, spend a lot of time describing it, discussing it, giving a lot of attentional response to it, thereby reinforcing it. And the second being the let sleeping dogs lie. This is oftentimes in families where there is a dearth or lack of high-level positive reinforcement occurring most of the time, but not always. So this is when a behavior is occurring in a child that a parent wants to see more of. However, they don't reinforce it, either because they feel like they believe that the behavior just should be happening, or, as is more commonly the case, that they have a history of when they attempt to reinforce their child for positive behavior, they can oftentimes trigger negative behavior. Think of walking around the corner and seeing a child coloring quietly and then tiptoeing back out of the room lest you upset the apple cart. However, both of these are situations we want to avoid. So the first phase of behavioral parent training encompasses differential attention. So the first skill is, in children, attending. Attending being a literal concrete description of behavior. You're putting the red block on the blue block, you're putting the green block on the black box, you're picking the toys out of the box gently and quietly, you're keeping all of your toys together and organized, things like that. For adolescents, this is less the high-frequency description of behavior and more noticing. You hung your coat up, you got right on your homework, you shut the door behind you, you said that very politely. So a word about this, many parents will describe that attending, whether for children or adolescents, feels like a pulling up short, like it's not praise and going on to say great job or well done. This is something that definitely needs to be addressed. This is an important skill by itself for a couple reasons. One, you can attend to a neutral behavior, whereas it's difficult to praise a neutral behavior, even though it may be more desired than a negative behavior. So the child who normally would make lots and lots of bids for parental attention, but instead sitting quietly looking out the window, a little disingenuous to praise and say, wow, great job sitting there looking out the window. But you can certainly notice and say, you're sitting very calmly today. Second is it's difficult to praise multiple things in a row. Praise keeps on top of praise, keeps on top of praise, because more and more difficult to get through. However, you can attend to multiple behaviors in a row. I'll sometimes use the example with parents that if you had a day off work and got a wild hair and decided to spring clean the house, just steam clean the carpets, wash the windows inside and out, defrosted the fridge, did all the laundry. Basically, your house is ready for its Better Homes and Garden shoot. Then I'll ask them which of three scenarios would make it more likely that they would do all this again. First, if the significant other came home and just said, hey, how was your day? Second, that they came home and said, wow, you cleaned, I love it, great job. Or third, they come home and say, wow, you steam cleaned the carpets and washed the windows inside and out and defrosted the freezer and went on to name everything that they've done. This is an example of attending to each portion of the behavior. Generally, parents say the third one. Some parents will say the second one, saying hearing, wow, great job would be more reinforcing. However, what they usually admit to is that they would be then quick to go on and go around the house and point out everything that they've done to their partner, at which point pointing out behavior is what's getting reinforced. Second skill is label verbal praise. This comes with an overview of the different types of reinforcement. The first being the limitation of tangible rewards or stuff, largely focusing on satiation effects, that we all tend to have a lower threshold for being reinforced by tangible objects, even money, food, or privileges. However, there's not such a satiation issue with praise or acknowledgement. The second being helping parents to use labeled rather than unlabeled verbal praise. And this is the second place where attending becomes important. By having that practice, it's a concrete description of behavior rather than vague terms. So the difference between unlabeled and labeled verbal praise being a great job, wow, I'm so proud of you, versus a great job getting your homework done, I'm so proud of you for studying so hard for that test, or saying that so politely or something else. The big issue here is that with unlabeled verbal praise, there is a possibility of inadvertently reinforcing an aspect of the behavior other than the one the parent intended to reinforce. An example of this would be, which we've all had happen, is a small child brings us a dandelion, pinecone, pebble, or scrap of paper. And we say, wow, thank you so much. And we get 50 more dandelions, pinecones, pebbles, or scraps of paper. Dandelion bringing behavior not actually being the aspect of the behavior we were most likely attempting to reinforce. Label verbal praise would be instead saying, wow, thank you so much. I love it when you do things to make other people feel good. You may still get 50 more dandelions, but it does make it more likely that you're able to reinforce that aspect of the behavior, the pro-social aspect. It also allows to focus on improvement, whereas with an adolescent example, an adolescent is told to clean their room, and a parent comes in and there are clothes piled high on the bed and the closet is overflowing onto the floor. The most likely response is, this isn't clean, you need to do better, look at the bed, look at the closet, thereby attending to and reinforcing the two aspects of the behavior they did not want to see. Whereas with label verbal praise, they're able to focus on the improvement and say, great job clearing off your dresser, your desk looks good, I like the way your nightstand's cleared off, most of the floor is picked up now, finish up with the stuff on the bed and the closet and you'll be all done. Thereby able to focus on the improved portions of it rather than on the general. Third skill, and this is for children only, is ignoring. Ignoring is different from simply not attending or not acknowledging or describing a behavior. Ignoring is an active withdrawal of all attention until such time as the child's behavior is regulated. This is a very important skill to teach in parent training with parents of young children, primarily not because it works as a standalone skill. There's very few behaviors that are actually able to be ignored effectively. Generally, only those behaviors wherein the parent's attention is the primary reinforcer, things like whining or hamstring or repetitive asking. Whereas other behaviors have a self-reinforcing component to them. So for example, you can ignore a child who's drawing on the wall, but you simply have a fully decorated house rather than a cessation of that behavior. However, this is only taught to children and not adolescents, because with adolescents, the behavior 99.9% of the time will escalate past the point where a parent is able to continue to ignore it. So it's primarily for the parents of children, beneficial and a necessary skill for when you proceed on to the second phase of differential parent training, contingency management, and are dealing with timeout. So in phase 2, which we come to now, the first skill taught is clear instructions. So addressing the nonverbal factors such as being very close to the child, being able to observe the context of the situation, making sure they want to give a direction, using tone of voice, pleasant and deliberate, dealing with things like yelling or pleading with children, things like that. And then focusing, although it breaks down more specifically when actually presented in a treatment modality, for summary purposes here, helping parents identify ways to give very specific, non-wording directions, thinking about the general context and timing of when they give directions, making sure that they're only giving directions at times where they want to and are willing to follow through, where getting the behavior is important to them. Focusing on do commands. This is highly important because it's frequent and very easy to give don't commands. The problem, of course, with don't commands is that it is very unlikely that you'll get a desired behavior in place of the one you are asking to end. The child version of this would be a child jumping on the couch. You say, don't jump on the couch. And the next thing you're saying is, no, don't climb off the back of the couch. No, don't climb on the chair. No, don't jump off the chair. And it becomes the whack-a-mole game, as opposed to a do command of sit on the couch or stand on the floor, wherein in order to be compliant, you've eliminated all of the behavioral options. The adolescent version, which is more likely, is saying something like, don't yell at me, and having the adolescent respond in a snarling or angry way. Instead, usually more of a, I'm not yelling at you, where growling is not the replacement behavior we're looking for. So instead of do command of ask me politely. Second phase is warnings. this is as you proceed into the contingency management portion. And teaching parents to use an if-then statement, so giving the direction only once. And then if you don't, repeating the do command, so if you don't sit quietly on the couch, then, and then what will happen next. So rather than going straight from a direction to a consequence, if there's always a warning in between, affording the child the opportunity to modify their behavior before the consequence is put in place. In terms of consequences, with children, and generally by children, this is 8 and under, or 9 and under for timeout, is 8 or 9 being the upper end of the age range for timeouts appropriate. Although I always recommend that this is thought of less in terms of chronological age and more in terms of developmental stage. I've seen 10 or 11-year-olds where timeout was still appropriate, and 8 and 9-year-olds where it was not. Timeout being timeout from all positive reinforcement. This is also in behavioral parent training where a lot of the specificity comes in. There tends to be lots and lots of mythology around timeout, such things as a few years ago I actually saw in Good Morning America a whole series where they were talking about timeout toys to help kids stay entertained in timeout, which would be highly contrary to actually doing an effective timeout. The second, which is a very popular one, is the idea of minute per year of age for a timeout, and teaching that this is actually not an important aspect of timeout. But instead, a timeout is timeout from positive reinforcement until such time as the child has regulated their emotion, calmed down in other words, and is ready to follow the initial direction. So the important, usually as a rule of thumb, this is plus or minus 3 minutes. There's no difference really between 3 minutes. It could be 2 minutes, it could be 5, or it could be 15 minutes, depending if it takes that child that long to calm down. And during that period of time, not looking at, discussing, or talking to the child, so providing no positive reinforcement. And then at the end of the timeout, returning directly back to the initial direction, this being an important element of timeout, that once the timeout is over, that they return to it. It's part of what differentiates the use of timeout as being a negative reinforcer of positive behavior instead of a punishment of negative behavior. And when used as a punishment, timeout doesn't work very well. It's simply not strong enough as a contingency. And a punishment-based paradigm or model is antithetical to behavioral parent training. For adolescents, this is first the SANE consequence model. So SANE is actually just an acronym to help parents select the consequences, which the S standing for small consequences being better than big ones, for multiple reasons, which we'll come to in a moment. The second is non-abusive. That's generally pretty easy for most parents. However, it is important that the behaviors not include hitting, slapping, screaming, etc. The N being non-punishing to parents. This is a lot of where it comes back to small. So a large consequence is oftentimes as punishing, if not more punishing, to the parents than it is to the adolescent. Ground an adolescent for a month, and the parents now become a jailer of that sulky adolescent for a month. Nobody deserves that, neither the adolescent nor the parent. So instead, small consequences, more consistently applied, have a better outcome than large consequences being put into place, which punish everyone in the family and result in parents being punished out of actually using contingencies or consequences. The E being effective, which is the foil of the small. Not that I'm a huge fan of grounding, but grounding an adolescent for 5 minutes obviously won't accomplish anything. Once upon a time, I did actually have one set of parents tell me that they tried everything. They'd even attempted to, their 14-year-old adolescent who had a marijuana problem, but they'd even cut his allowance in half, down to 200. When I asked if that was 200 a month, they said no, it was down to 200 a week, even on 400 a week before, which of course said a lot about the location of his marijuana abuse issue. However, clearly this was not an effective consequence of the adolescent. It wasn't meaningful to them. They didn't really notice it. Then the pattern becomes the use of differentiating between positive and negative consequences. Positive consequences being not positive in terms of good, but positive in terms of additive. This is adding a task, a demand, a writing assignment, a chore. In terms of the basic consequence pattern, a positive consequence is about a 3 to 5 minute chore. something, again, that would take the parent 3 to 5 minutes to do. This might take an adolescent 20 to 30 minutes or an hour or more to do, but there has to be some way to arrange it. A negative consequence being the loss of privilege, item, an iPod, a phone, internet access, etc. And then disengagement. That's the pattern with adolescents is first the direction being given, do this. So, get started on your homework. If met with compliance, it's praise. If met with non-compliance, it moves to the warning of if you don't, for example, get started on your homework now. Then you'll also, and this is where the positive consequence comes in, have to clean your bathroom. If at that point there's compliance, it's simply praise, no consequences are given yet. And if there's still non-compliance, then the consequence is delivered, which would be something along the lines of until you have done your homework and cleaned your bathroom, you won't be able to have any screen time, which would eliminate TV, internet, video games, etc. At which point the parents disengage and move away from the adolescent and simply enact the negative consequence. The best negative consequence being those that they can modify the environment to enforce rather than having to monitor themselves. From there, that's the sort of basic pattern. So you move on to topics such as setting standing rules. This usually means no more than 1 or 2 rules. In the adolescent or the child pattern, this is basically serves as a warning that's in place all the time. And again, only 1 or 2, and it means a discussion of being certain that the positive behaviors are still reinforced, even in the absence of the immediate reminder that giving a direction would give the parent. Also for children, it means dealing with situations outside of the home, how to deal with problematic behaviors in the car, in the store, at friends' houses. With adolescents, this often goes on to looking at school behaviors and specific applications like around homework or school achievement, and dealing with peer choice situations, including collaborating with negative peers or delinquent peer groups. And then negotiating as a way to begin with adolescents, giving them more input and direction on what the contingencies will actually be when the parents are willing to negotiate around it. And there's a specific format to start on with that, which definitely includes negotiating and attaching in terms of being behaviorally specific about the behaviors required, attaching specific contingencies to those behaviors occurring or not occurring, and setting a specific time frame that those contingencies will be in place around those behaviors. These are things like starting a homework tracker or chores or negotiating around access to friends, curfew, things like that. And then other specific applications. So things around sibling rivalry and conflicts within the family. Homework being a frequent area of conflict for parents and children. Chores being another frequent area, including room cleaning and participating in family chores. And then with older adolescents and young adults, the launching issues around going off to college or moving out of the house. More and more parents of 20 to 30-year-olds are coming and seeking help on how to deal with their now adult child who's living in their home, but with whom they're in frequent conflict. So some limitations. First, there's some research on outcome depending on problem severity. So generally speaking, the outcomes with children tend to be much better and much longer term. There are outcome studies, follow-up studies as much as 14 years later that show a statistical and clinically significant difference between families where behavioral parent training was delivered and where it wasn't, as opposed to adolescents where there is somewhat less, with certain types of problem severity, they may not be able to be managed in the home. There's also parent factors. The first and foremost, and there's actually a little bit of research on parent resistance and behavioral parent training, that resistance by parents to actually incorporating and using these skills is the norm, not the exception. As a matter of fact, the best outcomes come from cases where the parents come in with low to moderate levels of resistance and then become increasingly more resistant, and then less resistant and more willing over the course of treatment. Marital distress and marital conflict. There has been some research to show that during the course of behavioral parent training, there is a period of bump in terms of marital satisfaction, as parenting issues are one of the most common areas of conflict between married couples. And then psychopathology. Parents who would meet criteria for diagnosis with depression, major anxiety disorders, and definitely psychopathy or antisocial behaviors. There is a very clear body of evidence that behavioral parent training is much less effective. And with depression and anxiety, you do see some decrease in depression and anxiety with behavioral parent training being delivered. However, individual treatment is definitely needed in order to allow them to be able to use the skills at home. In psychopathy, it actually has to do more with parents who are engaged in a lot of antisocial behavior themselves. Conflict and distance from their kids serves more as a protective factor, whereas more close and engaged relationships are actually more of a risk factor. This is less of an issue generally in self-referred populations. Another thing that comes up frequently is a view of behavioral parent training and psychoeducation. There is some research done on this by Patterson and colleagues, and they looked at a stage model of intervention, first with bibliotherapy, so giving the parents the book and seeing what the response rate was, and about 10% of the parents who then passed the test showed significant improvement with their adolescents. Then it was a stage presentation, so those who were non-responders to bibliotherapy proceeded on to a group intervention with 3 to 4 families in a group. And about 70% or 75% of those families were treatment responders at that time, with a decrease in adolescent symptomology. This was an adolescent study below symptomatic levels. And then out of the remaining group left over who were non-responders to group, 25% of those remaining were responders with individual level parent training. And as it panned out, there was about 8% of the initial sample who did not show a response to any of those 3 levels. So it's difficult to transfer this model to the real world, largely because you rarely see the 10% that apply are successful with bibliotherapy in clinic settings. And usually by the time they present to treatment, group or individual is the more recommended format. Also, a lot of them have Kasdan's manual particularly, and even in the Patterson and Fogach, there's towards the end of a lot of the manuals, a lot of reliance on token economies. It's not that token economies don't work. However, they tend to be very cumbersome and labor intensive, and parents usually aren't able to keep up with them for any long period of time. I generally highly recommend that token economies be very, very targeted and specific to very certain behaviors, and have a phase-out pathing at the end. So this is something that we'll do for a month or until a large goal is met with a single large reinforcer. And then historically, there's been a lot of lack of recognition of the therapeutic alliance between the parents and the clinician. So Patterson and Reed and also Kasdan tend to refer to parents coming in, especially the parents of adolescents, coming into treatment with a history of 10,000 defeats. That this is highly important to them, and it's how they parent their children is central, even to for all of us, it's central to our self-concept. And it's a difficult area to change. And they've already tried many, many things. And if it had worked, they wouldn't be presenting for treatment. So I always caution that a lot of gentleness, a lot of awareness that parents will come into treatment with an expectation of being negatively judged and judged as failing in the role of a parent. And so there is a lot of importance on setting them at ease, establishing a therapeutic alliance and relationship between the therapist and the parent, which is, I suppose, one of, on a final note, my own objection to the term behavioral parent training. The training portion at the end makes it sound like something other than or wildly different from other forms of cognitive behavioral therapy. So it's a training episode rather than a therapeutic episode. However, getting people to change any set of behaviors, whether it's a habit is like nail biting, or the way they eat, the way they exercise, the way they live, and for certain the way they parent and the way they express themselves to their children is no mean feat and requires lots of validation, lots of support, and lots of encouragement along the way.
Okay. Well, thank you guys for sticking with us. We will transition into our question and answer period now, so I will pull those prompts up for you again. So feel free to use the question box to go ahead and type in any questions that you may have about today's session, as well as feel free to tweet questions to us at Valant with #ParentTraining. Before we grab those first questions and give you guys a second to type those in, I'm going to pull up an additional screen for us to let you know that if you are interested and you're currently working in a therapeutic setting and you're interested in consultation with Dr. Kirkpatrick, he is available for that as well. And you can go ahead and call directly to 206-374-0109, and they will be able to connect you with the appropriate people to get that scheduled. So we do have a few questions in here. So we will go ahead and address a few of those. First, there's a question about getting a copy of the PowerPoint slides. We can definitely make that available to you, so if you are interested, feel free to type that in the box and we will shoot you out a copy of the slide deck. Additionally, we will be hosting a copy of today's recording. There's a bit of a snafu with the recording at the beginning, but we will be hosting the presentation online after the session. Looks like there is a question about the house cleaning example, which one of the three spousal reactions was most desirable.
So this is actually a little bit of a question that comes up in terms of what's desirable and not desirable. It's not a matter of actually which one of those three reactions is most desirable. I think we can all be clear. The first reaction with no acknowledgement of the house cleaning behavior is going to be the least desirable one. At least that's what my wife tells me. However, of the other two, the question is more which of those last two, either saying, wow, great job, I love it, you cleaned, or going on to name all the aspects of the cleaning. Wow, you steam cleaned the carpet and washed the windows and defrosted the freezer, et cetera, is most likely to result in all of that behavior happening again. And so it's the third scenario where all of the aspects of the behavior are attended to that make it most likely that all of those different types of cleaning behaviors would happen again, as opposed to the second one, which might make it more likely that some level of cleaning behavior will happen again. And then in the real world, of course, saying, wow, you cleaned, I love it, would most likely prompt a bid to, yes, but have you seen what I did in the bathroom, in the bedroom, in the back room, in the et cetera? And what would actually be, the behavior that would be being reinforced there is the pointing out of the cleaning behaviors. So a lot of this is actually a good question because it comes back to a question that parents often have about, so am I doing it right or am I doing it wrong if I just praise or not praise? So this idea that, for example, unlabeled verbal praise is wrong. And it's not about right or wrong, it's about what's going to be most effective in terms of encouraging or increasing certain behaviors that they want to see more of.
Looks like we have another question from Kathleen, specifically dealing with children who are allowed to sleep in bed with the parents and how that impacts kind of this behavioral model.
Well, that's sort of a little bit of a different question. There's absolutely been a huge surge of co-sleeping in a movement, a whole co-sleeping movement of people who have their children sleep in bed with them, oftentimes to later ages. So I guess that's a little bit of a hard one to answer. I mean, if it's an anxiety issue with moving a child out of the parent's bed, that would be one thing. If it's more of just, a familial preference, it's a safety issue. So I'm not quite sure how to come at that one directly. It just sort of depends on what the goal is there.
It looks like we have a general question here that was tweeted into us, and it says, does this treatment have a sort of an effect on teaching children that they only love you if they're doing what you want them to do?
So about 3 years ago, there was an article in the New York Times in the Sunday section that was basically an indictment of the application of behavioral principles to parenting. largely coming at this idea that it makes love contingent, love and acceptance. I'm extremely clear with parents and when I'm going through the idea of rewards, which include talking about tangible rewards, physical rewards being physical affection, hugs, kisses, pats on the back, touch, affectionate touch in general, and then verbal rewards, the attending, the praise, the other. What I usually tell parents is if there were only one type of reward they could use with their children, physical rewards or physical affection would be it. Physical affection communicates love and acceptance in the way that nothing else can. And so the trick about physical rewards is that they can't really be used effectively to modify behavior, largely because you can't withhold them. You don't not hug your kid because they had a bad day or they've had a meltdown recently. That doesn't mean you go in for a hug mid-tantrum, obviously. But when since you can't really withhold it, you can't really use it contingently, nor should you. And therefore, it doesn't really work to modify behavior. I usually encourage parents that it needs to be there. It needs to be there at a high rate level all the time. And so that is usually the more confused question, which is the idea that love is not contingent. However, praise and attending and attention given to specific behaviors can absolutely be contingent.
Looks like we have another general question about the typical duration of how long you're seeing clients for.
Most manualized models are 16 to 24 session treatments, so about 4 to 6 months. I generally find that it just sort of depends. I've had it go as quickly as 6 to 8 sessions. It's very, very atypical. Generally, it is more about a 4 to 6 month treatment. With adolescents, actually, it can be a bit longer, mainly because parents continue to need lots of support and problem solving around the application of the specific skills to dealing with the situations their adolescent is in.
And then it looks like we have a question here about, with the introduction of a sibling, how that impacts kind of the way you're treating this, and there's specifics about sibling fighting and how do you kind of impose these different.
This is another one where the devil's really in the details, but in general terms, the most common thing to happen with siblings fighting, especially making hurtful comments to each other, is it's the sibling who's the aggressor who's making the hurtful comment who then gets most of the parental attention and response, which is usually aimed at getting insight. You know, it's not okay to do that. Don't you see how hurtful it is, etc. And so what happens is it serves as negative attention being a reinforcement of that behavior. So it's minimizing that and instead trying to place more of the attention on the aggrieved, if you will, sibling and coaching them how to deal with it and being able to reinforce that behavior more proactively. Sibling stuff is really, really difficult. I actually recommend there's a book by Faber and Maslish called Siblings Without Rivalry, which, although I'm not really big on some of the ways that they define contingency management, I think they're a little confused about the way they use the term punishment. However, it's actually the first few chapters of the book are a fantastic resource for helping parents think about sibling rivalry and sibling fighting and the way that parental responses can feed into it or not.
And I'm getting quite a few questions about getting copies of these specific manuals or where to find these resources. And what we'll do is there's a follow-up email that will be sent after today's presentation, and we will be sure to include just references to the manuals that were mentioned today by Dr. Kirkpatrick, as well as any other materials that he, whether mentioned or not, would think would aid in adapting these different manualized treatments in your daily practice. See, we're getting quite a few in here right now. There's a question specifically about aggression, and what would you recommend for children who bolt or leave the area or become aggressive to you while attempting to deal with them in session?
Again, this is a lot of the case of the specific child and a specific issue. However, sort of an overarching theme that's pretty important with behavioral parent training is this idea of intensity versus duration. So oftentimes when kids become aggressive or bolt, they're increasing the intensity of their behavior, and parents are likely to increase the intensity of their response to such a point that the behavior and the emotional arousal level snowballs. I usually recommend to parents to think in terms of instead of duration. You know, think of a simple example like, I've seen it before where a child dropped their coat on the floor on the way in, and from there the parents gave what they thought was a fairly simple direction of just hang your coat up. And next thing you know, it's been going on for half an hour with a back and forth, and the child's lost every privilege in the world, and the parent is going up in intensity. And eventually, it's usually the parent who says, well, this is crazy. I can't believe we got here over the end, over hanging a coat up. I'll just hang the coat up. It's not worth it. So usually it's helping parents lower the bar in terms of the intensity of the expectation or the intensity of the consequence, but then hold that contingency until the behavior is shaped.
There's another question about how does this treatment translate itself into more of a school setting?
Well, I would love to say that it translates fantastically, but I guess it sort of depends on what we mean by translate. So if with the parents changes the contingencies in the way they deal with the child at home, do the behavioral gains at home tend to transfer to school? And the answer is actually they generally do not, or there's minimal transfer. There's just so much impact of the context and contextual learning on the behaviors. So what I have found is that when the contingencies are switched around and the parents are feeling capable and are getting the responses they want from their child at home, they it usually means that I end up going into the school to help consult with the teacher, which, by the way, my wife is a teacher, so one thing that I found helpful to just in terms of think of is before school meetings rather than after school meetings. So I usually go in before school starts early in the morning and do a face-to-face consultation with the teacher about what the behaviors they're seeing, how to manage them, and then follow up by phone with them later.
And then this will probably be our last question. If you typed a question in and we weren't able to catch that today, just to let you know, we will be following up via email with any responses that are typed in, so don't hesitate to type more if you have additional questions, but we will follow up with you directly if we weren't able to get to those today in session. And then it looks like we've got this will be our last question. So do you think that the model is adaptable to a primary care setting?
Actually, it's interesting you should ask. My initial background, especially before going to graduate school, was as a counselor in a psychiatric hospital for juveniles. And I've also consulted extensively in the juvenile prison setting. And yes, I do think that it translates pretty well into residential settings. I'm wondering if that's the question, if the question of a primary care setting is pediatrics. In which case, usually in a more pediatric setting, a pediatrician setting, again, some parents, it's about that 10%, which is far from the majority, if just given a book as a reference, in which case I usually recommend to them parenting the strong-willed child by Long and Forehand as being the best mass market one for parents on this. Otherwise, finding people in your area, psychologists in your area who specialize in behavioral parent training that have some background in it and being able to refer to them.
And then this is just a general question. Is there a list for like a resource online that people can find people in their area that are specializing in behavioral parent training, or just individual websites of clinicians?
Not really. There's some of the main training modules. So the Incredible Years by Webster Stratton, which is a group format, they certify clinicians. So if you go to Webster Stratton's website, there'll be a link to a place for all the people they've certified, which means that they have specifically her videotapes, her manuals, they pass the test in it, and they have her specific puppets. And then there's also parent-child interaction therapy. They do have a certification program. I don't know how extensive it is, but I believe that can be found online as well. And PPP Parenting does have a certification practice, so you can look online that way as well.
Perfect. So with that, we will wrap up today. Thank you guys for your active participation in the question and answer session and learning more about this topic with us. So again, if you have any questions, feel free to reach out to us here at Valant and we can connect you. Feel free to call Dr. Kirkpatrick directly and set up a time for consultation if you do have a specific parent-child relationship that you're thinking of and would like to get some additional feedback on that. And with that, we'll go ahead and end today's program.